Okay, I just want to make this one last video where I'm going to summarize the reason that nicotine is addictive. Okay, so nicotine is going to act on these alpha-7,5 homopentamers, and it's going to cause the ventral tegmental area neurons to release dopamine into the nucleus accumbens, which will positively reinforce the behavior of smoking. And by the way, I just want to give you another piece of terminology. This is what is known as operant conditioning. When you train your dog to come when he is called by giving him rewards when he comes, that is known as operant conditioning. It's another form of conditioning. So we've all heard of Pavlovian conditioning, which is where one stimulus is associated with another stimulus, becomes associated with another stimulus. Okay, operant conditioning is the even more common sense form of conditioning, which is when you give someone a reward for doing something, they are more likely to do it again in the future. That is what operant conditioning is, the fancy name for that very common sense thing. Okay, one last comment I want to give is that nicotine activates both forms of the nicotinic acetylcholine receptor that are in the brain. Well, there's more than those two forms that I've told you about, but they're the main two forms that are in the brain. And although we always hear about how bad nicotine is for you, there is some evidence, in fact quite a convincing branch of evidence, that nicotine activating the nicotinic acetylcholine receptors in the brain can actually prevent and make you less likely to suffer neurodegenerative diseases. Specifically, it lowers your risk of Parkinson's disease. So people who smoke have a lowest risk for Parkinson's disease. Okay, which is the degeneration of these neurons within the substantia nigra of the midbrain. Okay, yes, okay, you'll die because of lung cancer, but you won't die of Parkinson's disease, so we can scratch those other minor side effects.